We're live, almost.
That's what I said.
Hello, everyone. Welcome. We're here at the Masonic Institute for Developing Brain with a bunch of geniuses in the room. We're going to be talking over here at the Twin Cities Mental Health Action Festival with the Masonic Institute for Developing Brain, Strong Mind, Strong Body Foundation, Youth Community Journalism Institute. And we're just going to be talking with some of the experts, brain experts, kicking off our collaboration, Brain Health Solutions for All. So does everyone want to introduce yourselves, maybe? Go around the room here.
Yeah, hello, I'm Jessica Simacek, and I direct our TeleOutreach Center here at the Masonic Institute for the Developing Brain, and I'm also part of the Institute on Community Integration here at the University of Minnesota.
Hello, I'm Dziwe Ntaba. I'm an emergency room doctor, and I have an interest in substance use, addiction, and mental health. Also here at MIDB, Community Engagement and Education.
Hi, I'm Haisley. I'm a pediatric neuropsychologist and the director of our clinic here that serves children and adolescents at MIDB.
Hello, my name is Brendan Turbo Clemens. I'm one of the research faculty here, and I study brain development in children and adolescents, and also how we can leverage that to inform treatment.
Hi, my name is Jesus Rojas. I am sophomore in Thomas Edison High School. I am also part of the community journalism.
Hi, my name is Christian. I go to South High School, and I'm here with Eric Ortiz. Strong Body.
And I'm Eric Ortiz with Strong Mind, Strong Body Foundation. So does anyone, you guys have a question for the experts, the researchers? I have a question. Maybe we'll start with what is one of the biggest challenges you know for your work that each of you are doing?
I'm happy to share some challenges. A lot of my work involves trying to understand and overcome barriers to accessing care for children and their families. And I think one big challenge that we're all kind of grappling with is there's just a big shortage of providers, and that doesn't seem to be getting better anytime soon. And so trying to understand how to help families access care now, and also knowing like we need short-term and long-term goals to be working towards. And so I don't have the answer to that, but that is a big challenge that we face on a daily basis in our work.
What about anyone else? Thank you for that.
I'll say that in the research brain science space, we really want the research that we do to reflect real people, real families, real teenagers, and that can be hard to do because research it's often limited to universities, and we haven't historically done the best of inviting people in. So events like this and working with you all is exactly what I think we need to be doing, is to make sure the science reflects real people and their interests and their families.
I think challenges from a clinic standpoint that we face at MIDB are very similar to what Jessica said, is just we have an access problem where we want to serve more members of our community. We want to make sure that we are accessible to people throughout Minnesota and neighboring states, and that we have a shortage of providers able to do that, and also that we kind of struggle with some of the things that go on more in our social political climate around like funding for coverage of behavioral health services and ensuring that people are able to access it through their insurance when they need to. So I think that's one of the things that we certainly grapple with too.
Yeah, I would say from the hospital emergency room side of things, we see a lot of the struggle and pain and problems that community members are facing when it comes to mental health. We're seeing more and more folks struggling with that nowadays, and then self-medicating with substances, and then the substances that are out there now, like fentanyl, can be very unforgiving. So people get caught up in addiction before they know it. One of the main challenges that we have as clinicians or public health researchers is we understand the disease, but we got to get the word out. We got to make sure people understand the risks that are involved nowadays. only that, if they're caught up in it, we need to make sure people understand their exit ramp. You know, there are medications that are very effective in treating addiction for opioids in particular. But people aren't looking at the same, you know, medical journals that we are. They're not looking at the same public health data that we are. So trying to get the word out and, you know, message risk for communities and then message health promotion for communities is a big challenge.
You know, that's what we want to do with this program and this collaboration is help get the information out to more people, you know, connect all the good work that's being done here with the community and the people that need it. You know, from a youth perspective, what are some, you know, how do you think this collaboration could help, you know, youth today?
I think your organizations or your programs is very important right now because we are like teenagers, always looking like for examples for follow. This work is very like motivational. I think that's a word. That's a perfect word for describe your work. Thank you.
There's a lot of teenagers doing all that stuff. Just getting the word out, you know, stopping it, trying to stop. Trying to. We should just try getting the word out.
Yeah, absolutely.
And that's what we want to do. You know, how could we, you know, in this collaboration, what would you know, how could we support you, you know, and help, you know, like what ideas you have, you know, we're working as a youth community journalism program, so we have a community news program, video show, have a start an audio, we have a print magazine, and we do these events. You know, how are some ideas that you have, you know, to reach more people? You know, what do you think would be a good way to do that?
I mean, I think helping us understand how to communicate with folks. You know, we talk to each other a lot, but we're not getting the word out where it needs to be. So talking to folks like yourselves, you know, hearing the lived experiences, what are your friends struggling with, what are you hearing the community struggling with. By feeding that back to us, then, you know, we learn how to better educate folks. So I think just being part of the conversation with us helps me be a better doctor, and thank you for that. I think the same is true for my colleagues.
And I think it tells us what research to do. That's how you build a relationship. If you're not talking, then we're not gonna lead anywhere good. So I think by talking, we can come to a shared vision of what science should be, and science should be what you guys think it should be, what the community wants it to be. And we have a long way to go all the time, but I would say particularly right now on making some inroads and improving on that.
And that's what we want to do, you know, is really work together to do this, you know, bring these young voices, you know, but all ages, you know, parents, grandparents, bring everyone into this conversation and, you know, find out what the issues are and then help get answers, help create solutions to those issues. You know, so just wanted to kind of introduce everyone to what's going on here. You guys are doing great work, and we're really excited about this collaboration and this opportunity to work with the community and with you, all of you, and learn and grow and help strengthen more communities.
Absolutely.
Yeah, thank you, Eric. and
Yeah,
thank you,
thank
your
you.
journalism.
Yeah.
Great.
So thank you all. You'll be hearing from us. Have a nice night.
Okay.